Welcome to our deep dive into a topic that could save a life: prostate cancer. Did you know that 1 in 8 men will be diagnosed with prostate cancer during their lifetime? This staggering statistic isn't just a number, it's a call to action and a reminder of the silent threat many face unknowingly. Detecting prostate cancer early is a monumental challenge. In its early stages, it often goes unnoticed, quietly developing without any symptoms. This stealthy nature makes it critical for men, particularly those over 50, to undergo regular screenings. Today, we're addressing the critical topic of prostate cancer, a condition that predominantly affects men as they age, becoming more prevalent with each passing decade. By understanding more about this disease, its risks, and the importance of early detection, we can arm ourselves with the knowledge needed to confront and combat this serious health threat. Let's delve into what you need to know and how you can take proactive steps for your health. Fact number 1. The unexpected age group. When we think of prostate cancer, we often picture older men in their late 60s or 70s. However, this perception is misleading and incomplete. Prostate cancer does not exclusively target the elderly. In fact, a growing body of evidence shows that younger men are also at risk, and the numbers are more concerning than you might think. Recent studies reveal that the incidence of prostate cancer in men under 50 has been steadily increasing. While it remains more common in older men, about 1 in 35 men in their 40s are diagnosed with this disease. This statistic not only challenges the common stereotype, but also serves as a crucial wake-up call for younger men who may not consider themselves at risk. The implications of these figures are profound. For younger men, a diagnosis of prostate cancer can be particularly aggressive, underscoring the importance of awareness and early detection. It's essential that we shift our perspective and recognize that prostate cancer can affect any man, at almost any age. This understanding should lead to more men getting screened earlier, especially if they have risk factors such as a family history of the disease. By broadening our view and acknowledging that younger men are also vulnerable, we can better advocate for widespread education and preventive screening. It's about changing the narrative from one that sees prostate cancer as an older man's disease to one that recognizes it as a broad, inclusive men's health issue. This shift is vital for earlier intervention, which can significantly improve outcomes and potentially save lives. Fact number 2, misleading symptoms. One of the most deceptive aspects of prostate cancer is the nature of its early symptoms. They're often vague and easily mistaken for less serious health issues. Many men experience symptoms that could be brushed off as minor urinary discomforts, like increased frequency or urgency in urination, which are also common in benign conditions such as urinary tract infections or an enlarged prostate. These misleading symptoms can lead to dangerous delays in diagnosis. For example, difficulty in urinating or a weak urine flow might not alarm someone who thinks they might just be getting older or are simply dehydrated. The same goes for other early signs like nocturia, needing to urinate frequently during the night, which many might not even mention to their doctors during routine visits. This ambiguity underlines why regular checkups are critical, especially as men age. Prostate-specific antigen, PSA tests, and digital rectal exams, DRE, are common screening methods that can help detect abnormalities early, even when symptoms are not clear or are easily attributed to other causes. While these tests can sometimes lead to overdiagnosis, the potential benefit of catching cancer early generally outweighs these risks, particularly for those at higher risk due to family history or genetic factors. Regular medical screenings can be life-saving, providing a chance for early intervention before the disease progresses to a more dangerous stage. This proactive approach is essential in combating prostate cancer effectively, making regular checkups a crucial practice for men's health management. Fact number 3, genetic surprises. Genetic factors significantly influence the risk of developing prostate cancer, making family history a crucial element in understanding an individual's susceptibility to the disease. If a man's immediate family members, such as his father or brother, have been diagnosed with prostate cancer, his own risk of developing the disease increases considerably. Specifically, having one first-degree relative with prostate cancer doubles the risk. And if multiple first-degree relatives are affected, the risk can increase up to 4 times compared to the general population. This genetic link is attributed to specific inherited mutations, including those in the BRCA1 and BRCA2 genes, commonly associated with breast and ovarian cancers, but also linked to higher incidences of prostate cancer. Other genetic markers, like mutations in the HOXB113 gene, have been identified as increasing prostate cancer risks. particularly when these mutations occur at a young age. Understanding one's genetic predisposition is vital. It's not just about recognizing an increased risk. It's about taking preemptive actions. For men with a significant family history of prostate cancer, genetic counseling, and earlier, more frequent screenings can be life-saving strategies. These proactive steps allow for early detection and treatment, which are crucial for better outcomes. This genetic insight emphasizes the necessity of discussing one's family medical history with healthcare providers, as it enables tailored screening strategies that could potentially catch the disease at its most treatable stage, dramatically altering the prognosis. Fact number 4, lifestyle's role. Lifestyle choices play a pivotal role in influencing the risk of developing prostate cancer. Research shows that diet and exercise in particular have a significant impact on prostate health, and modifying these aspects of daily life can lead to a lower risk of developing the disease. A diet high in red and processed meats has been linked to an increased risk of prostate cancer. Conversely, diets rich in fruits, vegetables, and whole grains have been associated with a reduced risk. Foods particularly beneficial for prostate health include tomatoes, which are high in lycopene, and cruciferous vegetables like broccoli and cauliflower, known for their cancer-fighting properties. Including more plant-based foods and reducing the intake of animal fats can significantly affect prostate health positively. Regular physical activity is another crucial factor. Studies suggest that men who are physically active have a lower risk of prostate cancer. Exercise helps maintain a healthy weight, improves immune function, and reduces inflammation, all of which can contribute to reduced cancer risk. Aim for at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous activity each week, along with muscle-strengthening activities on 2 or more days per week. Let's check what are the simple lifestyle changes. Shift to a plant-based diet. Gradually increase the amount of fruits and vegetables in your diet. Start by adding 1 serving of a cruciferous vegetable to your meals each day. Incorporate fish. Replace red meat with fish a couple of times a week. Fish such as salmon are high in omega-3 fatty acids, which are good for overall health. Exercise regularly. Even short bouts of exercise are beneficial. Take stairs instead of elevators or go for a walk after dinner. Maintain a healthy weight. Combining diet and exercise to keep your weight within a healthy range can significantly reduce your risk of chronic diseases, including prostate cancer. By making these manageable changes, you can take significant steps towards reducing your prostate cancer risk and improving your overall health. These lifestyle modifications are not just preventive measures but also enhance the quality of life, proving beneficial across various health aspects. Fact number 5, advances in diagnosis. The landscape of prostate cancer diagnosis has seen remarkable advancements, bringing new hope and saving lives with cutting-edge technologies. These innovations not only enhance our ability to detect prostate cancer earlier but also do so with greater accuracy, significantly improving outcomes for patients worldwide. One of the most exciting developments is the use of multiparametric MRI scans before conducting a biopsy. This technology provides a detailed image of the prostate, allowing doctors to identify suspicious areas that need closer examination. This targeted approach helps in avoiding unnecessary biopsies and pinpointing cancerous tissues more accurately if a biopsy is needed. Another groundbreaking advancement is the PSA, prostate-specific antigen density test, which considers the PSA level relative to prostate volume, offering a more nuanced assessment than PSA levels alone. This development enhances the specificity of screenings and reduces the instances of false positives, which can lead to overtreatment. Furthermore, genetic testing and biomarkers are now being used to assess the risk more effectively. These tools can predict the aggressiveness of the cancer, guiding personalized treatment plans that are tailored to the individual needs of each patient. This means treatments are not only becoming more effective, but also less invasive. These technological strides are a beacon of hope, significantly shifting the dynamics in the fight against prostate cancer. With each new development, we move closer to a world where prostate cancer can be managed more effectively or even cured. This progress represents not just a leap in medical science, but a promise of longer, healthier lives for men around the globe. Let's embrace these advancements with optimism and continue to push for innovation in cancer care. Fact number 6, treatment options that surprise. The treatment landscape for prostate cancer is evolving rapidly, offering new and promising options that are less known but highly effective. These advancements are paving the way for more personalized and less invasive treatment approaches, significantly enhancing patient outcomes. One of the emerging treatments is focal therapy, which is often likened to a male lumpectomy for prostate cancer. This technique involves targeting just the tumor with precise, high-intensity focused ultrasound, HIFU, or cryotherapy, leaving the rest of the prostate intact. This method can greatly minimize complications such as urinary issues and problems with intimacy, which are often associated with more conventional treatments like surgery or comprehensive radiation therapy. Another innovative treatment is immunotherapy, particularly the use of checkpoint inhibitors, which help the immune system recognize and fight cancer cells more effectively. Although this method is still in the experimental stages for prostate cancer, early results are promising, showing significant benefits in cases where other treatments have failed. Proton beam therapy is also gaining attention. This form of radiation therapy targets tumors with great precision, minimizing damage to surrounding healthy tissue and reducing side effects. Its use is expanding as more facilities are able to offer this sophisticated treatment option. The importance of personalized treatment plans cannot be overstated. Every individual's cancer is unique, and what works for one person might not work for another. Personalized treatment involves thorough genetic profiling and consideration of the individual's overall health and preferences, which guides the selection of the most appropriate treatment options. This tailored approach not only aims to treat the cancer effectively but also focuses on maintaining the quality of life, making the treatment journey as manageable as possible for patients. These exciting developments in prostate cancer treatment highlight the strides we are making in medical science, offering hope and improved quality of life to those affected by this disease. Fact number 7. The power of support. The journey through prostate cancer diagnosis and treatment is profoundly challenging, but the power of support from family, friends, and the community can make a monumental difference. Emotional, practical, and informational support can transform the experience, providing strength and resilience to those facing this battle. Family members play a critical role in offering day-to-day support, from attending doctor appointments to understanding treatment options and providing emotional comfort during tough times. The presence of loved ones can alleviate the stress and isolation that often accompany a prostate cancer diagnosis. Community support, including from cancer support groups, also plays an invaluable role. These groups provide a platform for sharing experiences, advice, and encouragement. They offer a sense of belonging and collective strength that is hard to find elsewhere. Men who engage with support groups often report better psychological well-being and a more optimistic outlook on their treatment journey. Moreover, broader community involvement through awareness initiatives is crucial. Raising awareness not only helps in early detection, but also drives research and funding towards better treatments and potential cures. Every conversation, every event, and every donation contributes to a larger fight against prostate cancer. Encouraging viewers to support prostate cancer awareness and research is vital. Whether it's participating in community walks, sharing educational materials online, or making contributions to research funds, every action counts. Engaging in these activities not only helps others but also enriches one's own life, creating a community that stands strong against prostate cancer. Let's unite in this fight, support, participate, and advocate for prostate cancer awareness. Together, we can make a significant impact, offering hope and support to those touched by this disease. In today's discussion, we've unveiled some critical aspects of prostate cancer that every man should be aware of. From its occurrence in younger age groups to the misleading nature of its symptoms and the significant role of genetics, we've explored groundbreaking diagnostic advancements and promising new treatments that cater to personalized care. Above all, we've seen the irreplaceable value of support from family and community in navigating this journey. There is real hope thanks to these advancements and the power of informed, proactive health management. Awareness and early detection are key. Do not hesitate to speak with your doctor about when and how to start screening for prostate cancer. Thank you for tuning in. Your health and well-being are important, and we're here to provide information that can make a difference. If you have questions or want to share your experiences, please comment below. Don't forget to subscribe for more insightful content. Together, let's stay informed and proactive in our health journeys.